Nathan.
The review process to approve a vaccine like this is a lengthy one. Former FDA Associate Commissioner Peter Pitts joins us tonight with more on what could be an historic week in the fight against COVID-19. Peter, thank you so much for your time tonight. We appreciate it. The FDA has sent more than 230 pages of data on both Pfizer and Moderna's COVID vaccine for kids as young as 6 months to outside advisors to review. What role does that outside opinion play in the overall review process, Peter?
That's a great question, because what the FDA has done is sent it to a group of advisors. It's called an advisory committee. And that means that its findings aren't binding, but generally speaking, the FDA follows their advice. And what the FDA wants to know from these advisors is, for example, does the benefit of COVID-19 vaccines for ages 6 months and up outweigh the risks? And I would say that they definitely do, and I suspect that's exactly how these advisors will ultimately vote, and the agency will finally move forward to allow these to happen. Obviously, the younger the child, the different the doses, the different the dosing schedule. I guess the most important thing to remember is that even though children are less likely to come down with COVID-19, and when they do, it's generally a lighter case, they are little virus incubators. And when you're vaccinated, you become less of a threat to others. So it's both good to protect the kids and also to protect adults from kids, like, for example, teachers.
You mentioned the benefits outweighing the risks. What are the risks of this vaccine for this particular age group?
The risks are actually very low. One risk that the FDA was looking at specifically was, very small instances of a heart condition called myocarditis. It didn't really appear for these young kids, so the FDA felt very confident to go forward. The benefits are profound, because obviously it keeps kids out of the hospital, it reduces deaths to almost zero, and it makes kids less infectious for the other kids and adults who are around them.
We have seen vaccines for this age group come up for review several times over the past few months, but it's still not available. What does finally having nearly everyone eligible for a shot potentially mean for our overall fight against COVID-19?
The more Americans who are vaccinated, the better prepared we are to move from an epidemic from a pandemic to an endemic, which means kind of like the annual flu. COVID's going to be with us every year. They will all require booster shots, and we'll lick it. And that's not just a small statement. Moving from pandemic to endemic really means that we have won the battle against COVID-19.
What should parents who may be apprehensive about getting their infants the COVID vaccine know about possibly getting vaccinated?
Obviously, parents have a lot of questions. These are new vaccines, and there's a lot of social media chatter out there that's not right. And everything I can say isn't going to change parents' minds. I think the most important advice I can give to parents is go talk to your pediatrician and follow her advice.
Former FDA Associate Commissioner Peter Pitts, thank you for your expertise tonight. We appreciate it.